The impact of this project has been fantastic.
We really couldn't have done this without UCLP's funding and support.
It's given us some space, it's given us some time.
Our aim was to reduce sepsis mortality at Princess Alexandra Hospital.
We're a centre that deals with major hemorrhages associated with a number of different specialties, and we felt that there was certainly room to improve our care for mothers and reduce their postpartum hemorrhage rates.
The problem we were trying to address at Homerton was a better sense of where our deteriorating patients were within the hospital.
The hardest things that a parent has experiences happens when their baby is admitted to the neonatal unit. But what is universally mentioned by parents who have gone through this experience is how utterly disempowered they feel.
Our innovation was to spread an improvement intervention from Wales to reduce harm from postpartum hemorrhage.
So we set out to try and investigate whether there was a benefit of procalcitonin in the emergency department, to identify patients with sepsis and also be able to guide our antibiotic therapy with these septic patients.
What we hoped to do is comes under the umbrella of family integrated care, where parents are very much partners in delivering the care for their babies on the neonatal unit.
So what we wanted was to create a brand new system that enabled us to track various comorbidities with patients, various states of patients, various urgent outstanding action, and also give us the opportunity to sort our patients by the sickest in the hospital. It was a collaborative effort within the hospital and freeing up, most importantly, clinician time to sit and work with technology from the ground up to say what we wanted and implement what we wanted.
Has really made us think hard about how we incorporate our families into this model of care and leading this change in the culture of the neonatal unit, and then the whole sort of quality improvement support in terms of training and the site visits have been really useful in trying to challenge us and push us in different directions and give us different perspectives.
That we use the money from UCLPartners to pay for our consumables such as TEG cartridges and our postpartum hemorrhage booklets, and initially the funding paid for part of that, but now that's been taken over by our maternity services, which really highlights that actually it's taken the funding from UCLPartners and taken the project and turned it into what is now a standard of care at the Royal Free. We've had improved risk assessment of our women and improved measuring of blood loss. And one of the biggest impacts is that we've had total removal of our use of fresh frozen plasma for our women.
We've performed data analysis on over 1,200 patients who had a procalcitonin in the emergency department. We've identified a high group of patients at high risk mortality rate and high risk of deterioration. We've educated close to 300 clinical staff at the hospital into the use of procalcitonin, and the benefits that procalcitonin can bring to our patients and their outcomes.
One of the biggest things that we've managed to do is set up our Starlight Superstars group, which is a group of families as well as staff, and the families are both current parents as well as veteran parents, and we meet every other month. Our families tell us what is important and what are the things that we need to be focusing on, what sounds good, what works well, what doesn't work well.
We were able to put COVID workflows and alerts within the system relatively quickly. So we were able to enable coronavirus activities next to the patients as well, which was really useful, which also allowed us to track which patients had been screened, which hadn't, and what their results of their tests were.
We know that procalcitonin has been used in the hospital during COVID-19, both in the identification of septic patients and also patients with potential COVID.
So we'd already implemented the Create as part of the Family Integrated Care Initiative, which is an asynchronous video platform where we upload videos to a very highly security-based cloud, and parents could then access it. That's been phenomenal. All of our parents very rapidly signed up for it and felt that that really allowed them to connect to their babies even when they weren't there. What we did notice is that because we'd started on this amazing journey, supported by the UCLPartners funding, is that the way we thought and how we approached COVID has really been very different.